Hello, everybody. Thanks for joining us for another one of these early career professional virtual grand rounds. If I haven't met you, my name is Pat Lyons. I'm an assistant professor at Oregon Health and Science University, joined today by some outstanding speakers, as well as by Dr. Kelsey Hills Dunlap, who's from University of Colorado. She's also exceptional enough to juggle this while also being on first day of service. So kudos to you. It's really great to see so many of you come out to learn and support two really outstanding early career scholars. We have a theme today. This is our first maybe thematic episode of this. So today's theme is real world data in critical care. And we're lucky to be joined from two outstanding individuals who are already national experts in this space as early career folks. So the way this will work is that we're going to give each speaker their opportunity to go through their talk. And we're going to reserve time then at the end of the entire session, so of both speakers, for questions and answers. So if you have questions, feel free to put them in the chat, or not the chat, I should say, but the Q&A box. The chat does not work on the webinar. And we'll collect them from the Q&A, and then we can also unmute you if you raise your hand at the end. And I guess as a final note, we are going to record this session and share it online so that folks who weren't able to make it can learn from us as well. So with that, we'll get started. We're going to hear first from Dr. Chad Hochberg. Dr. Hochberg is an assistant professor in pulmonary and critical care medicine at Johns Hopkins. He trained in internal medicine and PCCM at Hopkins by way of the University of Chicago. During his training, he was assistant chief of service in the Osler training program. He also earned a master's in clinical research from the Bloomberg School of Public Health at Hopkins. And he's a clinician scientist who uses health informatics to understand and inform evidence-based critical care practice adoption, optimization, and sustainment in the ICU. His talk today is entitled Bites at the Bedside, Big Data in the Intensive Care Unit. Chad, the floor is yours.
Great. Thanks so much, Pat. And thanks, Kelsey, also for the invite. It's a real honor to be speaking with you all today. As Pat said, I'm going to be talking about big data intensive care unit and some developments in how we're using multi-center real world ICU data. I have no financial conflicts of interest. I do have some funding that supported some of this work. And I am the site principal investigator and vice chair for new member integration for the common longitudinal ICU format, which I'll talk about fairly extensively today, but don't derive any financial benefit from. So here's what I'd like to get accomplished in the short talk today. One is to define big data and understand data sources and management of such data in the modern ICU. Give an introduction to common data models, and specifically the CLIF Consortium common data model. Talk about some active CLIF Consortium research, and then finally end with some future directions.